First, though, we have some health headlines. Joining us now is professor at Northwestern University Medical School and frequent WGN Morning News contributor, Dr. Lauren Streicher. Good to see you.
Good morning.
All right, we're going to start with a new blood test that predicts preterm birth.
Yeah, this is really exciting because if you look at the #1 cause of babies dying at birth, it's the preterm ones, the little ones, the ones that are born too soon. And while we can kind of predict it, there are some known risk factors, like obviously if someone's having twins or multiples, or with older women or black women, it's more common, or smokers. The #1 thing that predicts preterm labor and delivery is a history of preterm labor and delivery. But that doesn't help you if it's your first pregnancy, right? So this is a very exciting new blood test that just got developed, just got released, was just talked about at a conference. And basically, during the second trimester, about halfway through, they test a woman's blood, and there's a number of different components they're looking at, which is 75% predictive of if they're going to have a preterm baby. But even better, there are things they can then do to prevent it. There's a whole protocol which they put into place, and they found in this study that women that took part in this and were immediately started on this protocol with extra monitoring and some other things that they did, that they were dramatically able to decrease the risk of delivering early. And if the baby was born early, it still made it long enough that it spent a lot less time in the neonatal ICU. So don't expect this to see in your obstetrician's office in the next few weeks, but it's coming soon.
Got it.
All right, hormone therapy in post-menopause women.
All right, well, this is a very specific issue because it's about that getting up in the middle of the night to pee. I mean, let's just put it out there that women are not sleeping well post-menopause between the hot flashes and the restless leg syndrome and the aches and pains, but it's also getting up to use the bathroom, sometimes 2-3 times a night. And so they're always looking for ways that you can kind of decrease that. So this was a huge study in which they gave women who were not on hormone therapy, they gave them hormone therapy, meaning systemic hormone therapy, either a pill or a patch, and they found that there was a dramatic decrease in the number of women that were getting up in the middle of the night to pee. But here's the issue with the study, why it wasn't such a great study, is we know that part of the reason people are getting up to pee is because they're not sleeping because of the hot flashes and the aches and pains and all that. And the women in this study, they were having all of those symptoms. So did the hormone therapy help because it got rid of the symptoms or because it calmed down the bladder? So in my Substack this week, I actually get into the details of it because, you know, we look at these studies and it's like, okay, well, we're glad it didn't make it worse because there's some studies that show that it might even make it worse, but could it make it better? Well, it could. So it's an interesting study.
All right. Controversy over women taking testosterone.
Yeah. Let's start with the fact that testosterone is not just a male hormone, it is a human hormone, and it's just as important for women as it is to men. We make less of it, but it does important things for women. And just like in men, the levels of testosterone do decline as women age. But there's been a big controversy, which is why there was a huge New York Times article last week that I participated in. And the controversy is not about women being given testosterone. It's not FDA approved for women. I want to be clear on that, but it has been prescribed for years off label. It is not controversial that women who get testosterone in proper doses will have an improvement in libido. About 50% of the time. It's not 100%. It's not some magic potion, but about 50% of the time. The controversy is it going to help in other things like muscle strength, cognitive function, kind of a general sense of well-being? And the studies don't support that. But a lot of women are now going into their doctors and asking for testosterone because of what they're seeing on social media. They all want it because they think it's going to help with these things. And we're kind of saying, well, we don't really have the studies to say that it works for that. And there's a lot of anger from women who say, I want it anyway because I'm hearing how great it is. So what's the downside? Why not just give it to people? You know, testosterone's good for you. The downside is that it's being prescribed inappropriately in high doses and in pellets. So women are getting side effects, not just facial hair and balding and acne, but things like permanent lowering of the voice, which can be career killing for singers and other people. And we are starting to see abnormal buildup in the lining of the uterus with precancerous and even cancerous changes, so an increased number of hysterectomies. So you can't mess around with this.
No, you can't.
You know, it's okay to get some testosterone supplementation, but it really needs to be from an expert who knows what they're doing, not a pellet, not injections. it has to be done properly.
Don't get your medical advice on TikTok.
Well, there's
Oh, well.
that.
Yeah. All
And
right.
your cat might give you bird flu.
Well, we don't know if your cat can give you bird flu yet. What we do know is even though it is called bird flu, it's in lots of other animals, in cattle, and we're increasingly see it in domestic pets, particularly cats, because we're not talking indoor cats, we're talking about the cats that get out there and they're playing or eating the dead birds who've died of bird flu. Well, that's what they do, you know, and then they get bird flu. So a couple things you need to know. Number one, if your cat is having symptoms like, you know, nausea, vomiting, lethargy, fatigue, get your cat tested. Get your cat tested because there are increasing numbers. We don't know those numbers, and the reason we don't know those numbers is because what's going on at the CDC. You know, as I know you've been reporting, thousands of pages were taken down from the CDC that give us up-to-date medical information on infections, on vaccinations, contraceptions, the list is long. And while some of those sites are now being put up, there's a sign on the site, I just checked it this morning, that said these sites are being modified per the current president. So what that means is that there are certain pieces of information that are not on there, like how many cats are getting bird flu, how many of them are dying, is there a transmission to humans? We don't know. We cannot rely on these sites right now. So all I can tell you is if your cat or dog, for that matter, is not acting right, think bird flu and get them tested.
All right.
All right.
You can follow Dr. Stryker on Substack. Thanks for being with us.
Thank
you.
you. And we are going around town.
Hey, Anna.